The Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make Good Medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Hi, this is Good Medicine. I'm your host, Larry Pitts, and today we have our new, exciting, vivacious registered dietitian. Her name is Brenda Bodnar. And Brenda, I want to thank you for coming on the program. And this is going to be great because you're almost as crazy as I am, which is good. And so, Brenda, you've been our new registered dietitian for the diabetic program. How long have you been working for the tribe now?
I came at the beginning of September.
Okay.
Before that, I was at the Coeur d'Alene tribe working in their diabetes program and as their dietitian.
Mm-hmm. And so we sort of stole you away, huh?
Yeah, I've been looking to come to the Flathead Valley for a long time, and when this job opening came, I grabbed it. I grabbed the opportunity to come this way.
All right, well, that's exciting. You know, just so the viewing audience gets to know you a little bit, why don't we go over your background a little bit, who you are, who your family is, why you're here, what your philosophies are. You know, we'll give it just a big overall view of who Brenda Bodnar is.
Okay.
All right?
I'm originally from British Columbia.
That's up north, right?
Way north.
Okay.
Actually, I live about the geographical center of British Columbia, but as far as population goes, that's considered northern BC.
Mm-hmm.
There's not a lot more northern towns populated in BC, but that's where I was raised, and I grew up on in the Carrier tribe, on the reserve on Stewart Lake, and I moved with my family to Coeur d'Alene just about 20 years ago, and went to University of Idaho, and got my dietetics degree there. And right from graduating there, I went to work with the Coeur d'Alene tribe in their diabetes program, like I had said earlier. And I love to work in the diabetes area because I can work with Indian people, and you know, as you know, diabetes is prevalent in the Indian population, and unfortunately there's a lot of work for people in dietetics and nutrition in diabetes and in Indian country.
Oh, big time, you know, we know, and it's getting worse. Yeah, but now it's catching up in all the other populations, you know. I mean, the latest stat I heard is it's 3,000 new diabetics every day, which is horrendous when you start to think about that. And so, we know that you're a registered dietitian, you're in dietetics. How'd you get involved in, what got you going in this direction? I mean,
my first area of education out of high school was in culinary arts. In British Columbia, I went to culinary art school in northern BC and worked as a chef for several years. And so I have a love for food, and so that naturally gravitated, you know, towards nutrition in dietetics. And so when I go into my approach to dietetics and nutrition advice is naturally towards, you know, the food end of it. You know, what do I put on my plate?
Right, and it's got to be tasty if you're a chef.
Yeah.
You know, which is really neat because I mean, I'm just going to get excited here as a diabetic because, you know, most of the stuff that they have out there for us, you know, this diabetic chocolate is like,
Yeah.
You know? And so there's ways of dressing things up.
There's ways to do your menu. There are ways to prepare your food that make it tasty without having to add a lot of sugar, without having to add a lot of salt, and being able to do it simply and inexpensively. If you can't afford to cook, you know, in a culinary fashion, then you're not going to do it. And if you don't know what ingredients are, you're not familiar with working with different ingredients, you're not going to go out and pay good money to try something that you might not like.
You might mess up.
Yeah.
Exactly.
Yeah.
Well, now this is the carrot, okay? Because we're going to come after our PSA halfway through. We're going to talk about Thanksgiving, how to do some certain things. So, viewing audience, you know, you're going to get stuck on this one because this is going to be exciting. I mean, I'm going to take notes, okay? I'm ready, baby. I'm set for this one. So let's go back to the diabetes, because you know you were hired by the Diabetic Project, the program, and you're running that program. And why don't you talk about what the Diabetic Program is doing here on the Flathead Reservation, what some of your ideas are for the future, some of your dreaming, you know, let's have sort of fun here, okay?
Okay. Well, the diabetes program at Flathead was already up and running. It has a good running start and is already well developed. And so I got to come into a program that's already established. The Tribal Health has 5 areas, geographical areas that they service, and they are Arley, Dixon, St. Ignatius, Charlotte, Ronan, Pablo, Polson, Elmo, and Hot Springs. And each of those areas has a public health nurse and CHR team that services those areas. And I just work with those public health nurses in each of those communities or in each of those areas, in each of those satellites. And then of course, Ronan and Mission, St. Ignatius both have clinics serviced by doctors, physicians, family physicians, and physician assistant. Arley also has that service, that satellite service in their area, and I work with those teams.
Okay. Now, somebody sitting out there who's diabetic, who has some really questions about their food intake. How do they get hold of you?
I work out of the St. Ignatius office, and our number is 745-3525, and I work in the program with Nancy Grant, and both of our offices are in there in the diabetes resource room. And if I can't be reached, then Nancy can be reached, for calibrating monitors, for education, handouts, anything like that. Okay.
Now, are you on the road a lot? I mean, are you traveling from one clinic to the other?
Yes, I try to get to every clinic, and the natural time for me to go is when people are already coming to those clinics, and those times are when they have their foot care clinics. And so they already have a lot of diabetes population coming into their clinics, and so I'm just there and avail myself with handouts or whatever I can do.
And answer questions.
Answer questions.
You bet. Well, and for those out there right now who don't know about the foot care clinics, we have them in Arley the second Thursday afternoon of every month. In Elmo is the second Thursday of every month. In Hot Springs is first Wednesday of every month. Polson by appointment. Ronan last Monday of the month. And St. Ignatius is, we got 2 dates on here, November 20th and December 18th. So apparently they don't have one set.
There is a set date. It just so happens that set date,
holidays.
Falls on the 2 holidays, and Thanksgiving and Christmas, and so they had to change those dates for November and December, and then they'll be back to their regular scheduled 3rd Thursday of every month. At St. Ignatius.
So in your travels so far since September, you've been to the foot care clinics. How do you rate them?
Oh, I think they're wonderful. The thing that really stands out about the foot care clinics is that every nurse from every office, from every area, does their foot care the same way. So there's consistency. If somebody normally got their foot care done in Ronan and happened to drop into the Arlee Foot Clinic, they would find the very same service, and they would find the same education, the same level of care and proficiency in foot care at any of the clinics.
Okay. Well, I got this national newsletter in front of me. It's called the Diabetic Newsletter, and it's by Brenda Bodnar, RD. Oh, that's you. Okay. This is new to our reservation, so this has to be your idea. I'm going to hold it up here really slow so the camera can focus in on it. And it's called the Diabetic Newsletter. Apparently, is this coming out monthly?
Yes.
And what sort of things are you going to be sending to the diabetics?
Well, what I've found, there have been assessments done, community assessments and questionnaires and surveys, and it seems that the diabetes program is providing good services, high quality services, and cover the whole spectrum of diabetes care. But many community members don't know what's available and how to reach someone to find out about a foot clinic, about how do I get an eye examination, do I qualify, does Medicare cover certain services? And so the newsletter, I would like to share with people what the program is already providing. Okay. Sometimes some people think that the services are not available when in fact they are. It's just not public knowledge.
Yeah, it hasn't been advertised very well.
Yeah, and a lot of the stuff is advertised well, but there are a few people out there that need to get the information in a way that's useful for them. Dates that they can put on their calendar, information that they can use today.
You're right. Well, in my cheat sheet note down here, we're talking about certain things that before we got on the air, and one of the new things is. Well, tell me some of the new things that you are learning about in the diabetic world that are coming up that they're.
I think the newest diabetes changes is that there was a big research study that took place and was completed this year, and it was the diabetes prevention program, and what that said is that diabetes can be prevented. Some of us already knew that,
right.
but I think that it has to be done in a research fashion under controlled circumstances for the science of it to say what we had always thought about it. And the good thing about this research is that it included Indian people in the study. They don't always.
Right.
Sometimes they're studied a different population.
Or the Pimas, or just the Pimas.
Yes, or in another country. What we want to be able to know that the information of the science is related also to us, where we live, regardless of whether we live in someplace big or if we live in rural Montana or Idaho.
Well, one of the new things that came out is pre-diabetes. Want to talk about that a little bit?
Yeah, pre-diabetes was kind of classified as several other diagnoses. And what it is that they found that complications are taking place in people even before they have the magic numbers of the diagnosis of diabetes, of blood sugar of 126, and they found that numbers beneath that, lower than that, people were still creating or building heart disease and other complications up to that magic number. And so pre-diabetes diagnosis had the numbers of 110 to 125. They recently, recently in the last couple of weeks, have lowered that number even more. So now if you get screened to see whether you have diabetes or have pre-diabetes, they're looking at the number of 100 milligrams of glucose per deciliter rather than 110 now. They're dropping that number, saying the earlier we catch this and have treatment available, the more we're going to be able to prevent some of those complications.
Okay. Now, is diabetes preventable?
Yes, the science says that it is preventable if it's caught early enough. And the treatments that were researched were healthy eating, and that was eating less calories, eating fewer calories, less fat, and those are the two components of the study. And then exercising, any type of physical activity at least 5 days a week.
Yep.
And their labs, their glucose values came back into normal value.
And we have facilities. You know, we have the Ronan facility. We have the St. Ignatius facility for working out. We're going to soon have our Arley facility. The college has their own facility. There is a at-call facility in Elmo that you can get a key from the CHRs up there. There's 2 for-pay facilities in Polson. So we have them reservation-wide.
Yes, and I have visited all of those. Of course, Arley's not open yet, and I'm excited for it to open. But they all are serviced with wonderful equipment, wonderful personnel. There hasn't been a time when I've gone into any of the facilities and not been, welcomed, and I never felt like I shouldn't be there, or
Yes.
I don't know how to get on this machine or that machine, and I'm leery about approaching it. Everyone's been real friendly and real helpful in making me feel comfortable.
Yep. Yeah, I know. Well, most people were trained at the Cooper Clinic down in North Dallas, Texas, and so that really helps. Well, Brenda, we're well over halfway done with our program, and so we're going to stop on diabetes. We're going to take a quick break here with Chef Graham Kerr on healthy living through your diet. So, viewing audience, enjoy that, and we're going to come back with Brenda, and we're going to learn about some Thanksgiving cooking. So, don't go away. We'll be right back with Brenda.
Hello, here's some more fruit and vegetable news you can really enjoy. Chestnuts. Now, they make a wonderful side dish for a holiday turkey because, you see, they're very low in fat and they're high in flavor. And you can find them fresh in the supermarket produce section, or you can already get them roasted, and they come in jars or vacuum packed. You know, what I really especially love with these little fellas is when they're left whole and they're poached in a chicken stock. And what you do is you simply cook the peeled chestnuts for about 20 minutes and then thicken the juices lightly with cornstarch, and just add 1/4 teaspoonful each of thyme and sage and a tablespoonful of fresh parsley. And 1/2 cup of chestnuts makes a very festive, and it's low-fat vegetable serving. They really are a celebration when served with any one of your holiday roasts. They're also great for snacking. So go on, please do yourself a flavor and enjoy your 5 or more servings of fruit and vegetables every day, even holiday.
And we're back from that short PSA with Chef Graham Kerr, and I hope you learned a lot about healthy living through your diet, and take note of that, because our diet means such a difference in our health. We want to thank the Flathead Diabetic Program for presenting those PSAs, and we're just continuing looking forward more to those and other ones in the future. So I got the person who's part of that, so I can thank you for that. So thanks, Brenda. So now we're back with Brenda. And as we promised, this is Thanksgiving time. We're coming up, and so why don't you tell me some things, some tips that our viewing audience can learn about their turkey and their, the sizes of food that we should eat so we don't get sick and throw up and all those wonderful things. So Brenda, you're on.
Actually, this is real timely because Thanksgiving is next Thursday, and now's the time to be really thinking about, what you're going to plan, when are you going to buy your turkey, how you're going to prepare it. Are you going to use one of those cooking bags that you seal up, or are you going to, cook it in an oven? Which pan are you going to use? Are you going to cook it on the barbecue? How are you going to cook it? But more importantly, you need to start thinking about it now, because if you don't have it purchased over the weekend, you're really going to be running too late if you buy it frozen, because it really needs to start thawing by Monday in the refrigerator on the bottom shelf, so that if, as the turkey thaws, any of the drippings, any of the ice doesn't drip into any food beneath it in the refrigerator. So that's important that it's on the bottom.
So it's not smart to put the turkey in the sink, turn the hot water on, and try to thaw it out in the last.
People say, well, this is how my grandmother's, this is how I seen my grandmother do it always. Well, our grandparents probably had a lot more bacteria in their stomach to fight off infection than we do, in our age of antibacterial soaps and Clorox wipes and, the world of clean. We don't have the natural antibodies and the ability to fight off the germs that we used to be able to fight off. Our grandparents used to. And so no, it's not a good idea to thaw your turkey at room temperature or in the sink. It really needs to be in the refrigerator. As the outside of the turkey thaws, the inside is still frozen, and so the outside, the part that's already thawed, is really open to bacterial growth, while the center of it is still frozen and not growing bacteria. So yeah, it's important that it be thawed in the refrigerator.
Okay.
And it usually takes about 4 days, because the average person, the average household purchases about a 20-pound turkey. We don't see people that buy 8-pound or 10-pound turkeys. Those you could probably thaw in about 2 days. Right. But most people buy the big ones.
Well, we want leftovers.
Well, yeah.
Those turkey sandwiches are actually better than the turkey at the meal.
That's what some people say.
Yeah. So good. So now, what are some other tips that our viewing people can start to think about?
There are a lot of places to get instructions on how to cook turkeys. First of all, on the bag that the turkey comes in, there's always cooking instructions on the side and thawing instructions, both stuffed and not stuffed. But if you've really reached the point and you've taken take the turkey out of the bag and thrown the bag away and said, okay, now what am I supposed to do with this, and don't know where to go, the USDA has an 800 number, and I have that number here. Okay. And it's a toll-free number, and it's nationwide, but and they're from 10 till 4 every day, and that's Eastern time. Except on Thanksgiving Day, they'll be there at 8 in the morning Eastern time until 2. That number is 1-800-535-4555. And
so 535-44-4555. Okay.
And it's one of the regular computerized answering machines, and if you keep dialing in or clicking in on the follow the instructions, and if you really need to speak to someone, ask to speak to a live person, and they'll answer your questions. They'll guide you through the cooking process of your turkey. They'll say, well, what does the bag say? How many pounds does it? Does your turkey weigh? What kind of an oven are you going to cook it in? Or is it a wood stove? Probably not. Is it electric oven? Is it gas, propane? What type of heat is it?
You can't microwave a turkey, can you?
People have done it. Actually, I have done it, and it's a nightmare.
Okay, good.
It's
too big.
It's too big. It's too challenging, because you want to be safe. You don't want to have all your family and friends and in-laws and whoever come over to your house and have a wonderful feast, and then to end up being sick all night. That night or the day after.
Right. Okay.
Yeah, it's not worth it.
Okay.
You'd become unpopular in-law
very quickly. Quickly. That'd be your new name, quickly. Now, let's talk about one of the other things that happens at Thanksgiving time is we always eat too much food. And then you feel so miserable instead of eating the right proportion and you're doing it more often. So let's talk about portion size.
It's hard. It's really difficult when you're around family and you're in a social occasion to get carried away. And people say, well, can't you just learn to push yourself away from the table? Well, not always. You can't always do it. And sometimes you have to kind of scope all the food out first and say, what can I live without? Like at this meal, maybe I can live without mashed potatoes, or maybe I can live without the stuffing this year, or maybe I can have either the pumpkin pie or the apple pie and not both.
Right.
making some choices ahead of time before you start, because sometimes once we start eating, it's kind of like you're in the middle of it, and there's no end until
It's
you.
called F&F.
What's that?
Frenzy.
Feeding frenzy. Yeah, sometimes that happens, and it's difficult to stop once you're in the middle of it. But if you've given it some thought ahead of time and said, this is where I'm going to draw my line, and if people ask me any questions, or if I'm afraid that I'm going to offend somebody, I'm just going to explain that I really need to watch what I eat, and I need to be careful. My sugars have not been good, and I need to do this to keep my health.
Right.
And sometimes, most of the time, people will accept your self-care.
Yep, and take more plates of food home.
And yeah, take some food home. Portion control is often a problem at times like Thanksgiving, when there's so much food. There's large quantities of food. You almost feel like you need to devour as much as you can while it's there. Some of us think, well, when I was a kid, there were a lot of days when I went without food, or when I went away from the supper table hungry, or when I had, stuff was available to me that I don't have on a normal, normally, then I'm going to really pig out.
Yep.
Since it's here. There's a few little tricks that, if you remember, about portion control, and that is when you're filling your plate up, if you remember to have only about a handful of turkey or meat, whatever the protein food's going to be.
Would that be sort of like the drumstick?
Yeah, actually the drumstick big drumstick would be more than a handful.
Right. Okay.
But, well, if you took the skin off and the bone out, you'd have probably just under a full drumstick.
All right.
And then if you're looking at the starchy part of the dinner, the potatoes, corn, peas, beans, rolls, the serving size is about the size of your fist. So if you picture your plate, the amount of turkey that's on this part of your plate, the amount of
and then there's your bread,
the starch, and then the amount of vegetables, non-starchy vegetables. If you cup both of your hands, you really can have a lot of non-starchy vegetables that fills your plate.
There we go.
There we go. And that's your
a full
plate.
There's a full plate.
And then if you want seconds, fill your plate up again, wrap it up, and take it home.
All right.
Well,
those are good tips, Brenda. We're now winding down to our last minute here in the program already, which is, it's amazing how fast it goes. Why don't you give your short PSA on your program and where you're heading with, with the new RD in our diabetic program?
I'm actually still working programmatically, doing the newsletter, doing the PSA, working at each of the sites.
Okay.
That's what I'm doing.
How are you going to touch the people? I mean, it's really nice to have a tribal member as our new registered dietitian. I mean, will you go to people's houses if they call and want one-on-one counseling?
Yes, I will. I will be doing that, and I'll let people know when I'm available to do that, and I'll be part of teaching classes, cooking classes.
So we're going to start some nice cooking classes, and all right.
Yeah.
Well, that's really wonderful. I guess now we're winding down. We're in our last probably 20 seconds here, and so I've got one really last tough question to ask you. You always have a really infectious left eyebrow, and while you're thinking about that, I want to thank you for coming on and being my guest today. I really encourage you to come on more often. We're going to try to do it every month, maybe have you on once a week, once a month, and so we'll get to know you really well. You're a great guest. I want to thank my viewing audience for watching today. This is Larry Pitts saying have a great day, and we'll see you next week.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care, and we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at